Namaskar. In this video, I will discuss about pregnancy, childbirth and menstrual disorders. The practice of yoga nidra throughout pregnancy helps to create the most favorable conditions for intrauterine growth and development. It is now well recognized that stress liberates hormones into the mother's blood, which profoundly alter the well-being of the infant. Stress hormones such as adrenaline and noradrenaline cross the placental barrier and enter the fetal circulation. There they act as toxins and poisons, disturbing the ongoing mental and physiological development of the fetus. Highly stressed mothers who do not yet know the art of relaxation are thus more likely to produce children who develop maladaptive behavior, hormonal imbalance, and endocrine disturbances in their own teenage and adult lives. Yoga Nidra also has an important role in the techniques of natural childbirth, such as the Leboya technique, which deep physical relaxation and spontaneous breath awareness form the basis for drug-free labor and delivery. In maternity hospitals where training in yogic relaxation practices is included in prepartum medical management, expectant mothers routinely experience less anxiety before the onset of labor and less pain during labor and delivery. The result is a confident, conscious mother who experiences a natural childbirth devoid of undesirable complications, and a healthy baby who emerges into the external world relaxed and unscathed. Yoga Nidra has also been prescribed for the relief of pain associated with dysmenorrhea, disturbance of the menstrual cycle, and excessive levels of premenstrual tension. In a study conducted at East Texas University, USA, researchers concluded that yogic relaxation training should be prescribed more frequently as an adjunct alternative to conventional drug therapy for menstrual ailment and pain.